Hello, everyone, and welcome again to St. John's Riverside Hospital's educational webinars for our community. Today's topic is monkeypox. My name is Denise Bananas. I am the Assistant Vice President for External Affairs at St. John's, and on behalf of my team, whom I'd like to thank, we appreciate you being with us today. So Jason Latour is our Media Production Manager, Nancy Nabi, our Community Liaison, Candace Cousins-Hopkins, our Associate Director of External Affairs. Without their work behind the scenes, this would not be possible. Also, I would like to thank our community partners. Sally Pinto is from the Yonkers Neighborhood Naturally Occurring Retirement Community under the umbrella of the Yonkers Office for the Aging and Westchester Jewish Community Services. And Z Baird is from Yonkers Public Library, and those three fabulous locations are Riverfront, Will, and Crestwood. So if you haven't visited one of them recently, you should. But thank you both for helping us spread the word on these wonderful programs. Today's speaker is Dr. Radhika Hariharan, and I want to tell you a little bit about her. She is an infectious disease specialist in Yonkers and has over 34 years of experience in the medical field. She graduated from the University of Maryland at Baltimore. She completed her internship and residency program at Temple University Hospital in Philadelphia, followed by a fellowship at the University of Illinois, Chicago. She is board certified in both internal medicine and infectious disease. Dr. Hariharan held a position as an infectious disease physician at the Mount Sinai Medical Center in Chicago for 3 years before opening her private practice here in Yonkers. That was in 1997. She has been affiliated with the St. John's Riverside Hospital since 1997 and serves as the medical director of our Hope Center, which is located at our Park Care Pavilion. Her passion and expertise in the field have led her to help educate future physicians. Dr. Hariharan is currently a core faculty member for the St. John's Internal Medicine Residency Program. She is also an adjunct clinical assistant professor of internal medicine and infectious disease for St. John's academic affiliate Lake Erie College of Osteopathic Medicine. This is a little bit of a side note, but I think it's very important that you know this. During the height of the COVID pandemic, Dr. Hariharan played a key role at St. John's, helping to navigate the complexities of the COVID-19 virus. She established patient treatment options, informed physicians and staff of the up-to-date medical news, and recommended strategies to keep our community safe. So before we begin, I'd like to just say welcome. Thank you for sharing your time with us. And Doctor, I'd like to start right now. Let's unmute you. Hi, Doc. How are you?
I'm good. Thanks, Denise.
Of course. So let's jump right in because I know there's a lot of people here who are very interested in this subject that has been getting a great deal of media attention. So let's start with the basics. What is monkeypox?
So monkeypox is a viral infection. It's caused by the monkeypox virus. It's in the family of orthopox virus, which includes most, probably well known is the smallpox virus. So it's a relation, but a much less deadly relation of smallpox. It was discovered in 1958, which is how it got its name of monkeypox, which is kind of interesting. They noticed that there were these monkeys that were being kept for research, and they developed these lesions on their skin. And that's how the term monkeypox came about. And it wasn't until 1970, basically in Africa, where they started having human cases of monkeypox.
Okay. And it's not related at all to, say, the chickenpox?
And it is completely unrelated to chickenpox.
Okay. So that's very interesting. It started with monkeys, obviously getting its name that way. So how is it now transmitted and jumped to the human species? So how is it transmitted from person to person?
So the main way it's transmitted is close physical contact. So it's really often skin to skin contact with either the monkeypox rash or with body fluids from the rash from a person who has monkeypox. It's also can be transmitted by what we call fomites, which are particles left of the virus on inanimate objects, such as bedding, such as sheets and towels that have been used by somebody who has monkeypox.
Okay.
And lastly, the last way it can be transmitted is prolonged face-to-face contact. So kissing or perhaps sneezing in somebody's face, snuggling and sleeping with them face-to-face, those would be other ways that you could acquire it from someone, yes.
Very interesting. Okay. So you had mentioned that it started in Africa, and so how does it spread from where it began and end up here where we would normally not see monkeypox cases?
It's a good question, and I think it's still a little bit under debate. It's endemic in parts of Africa, in Central and West Africa, and it's thought the reservoir is probably like a small rodent. Before 2022, the only times we saw monkeypox outside of those countries in Africa were really in travelers who had been to those countries, or when there were animals that had been imported from those countries. The US had a prairie dog outbreak several years ago where humans got monkeypox from their prairie dogs. And they thought the prairie dogs had acquired it from some rodent that they had also imported from Africa. So in the past, they've all been linked in that fashion. So this is really the first time that is not the case. This started in May in the United Kingdom. That's when they noticed the first cluster. There was a separate incident of a man who had been in one of these countries in Africa who arrived there and had monkeypox, but he was very quickly isolated. And they really felt that he did not transmit it beyond that. But at about the same time, they started noticing these clusters, and it was often being reported in clinics that served communities, certain communities. And and from there it spread to Europe and North America.
Okay. As an aside, I just want to tell anyone in our audience, feel free to enter questions into our Q&A. And at the end, I will, if we haven't already addressed those questions, we will go back and ask them. So feel free to put them in there. Okay, so monkeypox is here. So what are the most common symptoms, and what are some that might be atypical?
So this outbreak has been atypical compared to what monkeypox had been seen in the past as. Mainly because the rash now, which can be in any part of the body, is often seen in the anogenital area. And that's a little bit unusual. It's also being seen on hands and faces and torsos, the rest of the body. But there's been a component of it that's been found in that area. And that has been unusual compared to the past. The other part so those are sort of the skin manifestations. At the same time, people can also have fever, they can have chills, they can have swollen lymph nodes, they can have headache, flu-like symptoms, and some people don't have any of those. So there's really a very wide array of symptoms you can have. But the predominant ones are sort of like not feeling well and then developing some form of this rash. So the rash can be described as sort of pimples or blisters. They can be itchy or painful. And again, there's a wide array of.
So the rash is really the thing that will separate this from something else, because those other, the other symptoms that you were talking about could actually be, any number of other viruses that are out there, the fever, the chills, all of that could be anything, right? So
absolutely.
So how long does it take for the rash to show itself?
So generally within several days, if you have those constitutional symptoms, within several days you will then have the rash. But I think you make a very important point when you say if you have these symptoms, there's absolutely no way to know, are you just coming down with something, including COVID. right? Which could present just with fever as well. So I think what we're learning more and more is that when we don't feel well, that we really need to listen to our bodies, and we really need to take a step back and say, I'm not well, so I need to not mingle with other people. And I need to create some distance, and I need to see where this is going. I mean, we're very used to, as a society, I think, that, you power through everything. So I think COVID has been kind of a big change for us,
Right.
where we actually say, I'm not well, I can't go to work today, right? So I think that's and so I think monkeypox also fits that. You're not well, you don't know where this is going. It's time to take a step back.
Right.
And do that.
So when we had our pre-meeting about this, Doctor, you had mentioned about there were 2 strains of monkeypox that are sort of present. One is here, and the one that we're seeing, and how dangerous that one is versus the one that's, I think you said it's in the Congo.
Right.
Can you comment on the because I think that's part of the concern for our community, is how dangerous is this to someone?
Sure. There's within Africa, there is monkeypox in West Africa, and there's monkeypox that's called in the Congo region. And the Congo-based variant is much more serious, and the mortality rates associated with that are almost 10%, whereas the West African variant is 1% or so. So we're also, I think, using percents related to people living in Africa who may not, I'm not really sure how well that translates to us. But basically, the prevalent, this whole outbreak is associated with the West African strain, which has been in general not a very virulent process. It's been infectious, but people have done very well. And we've supported people through it fairly well.
Okay, so the next question that we have are, the media has been sort of all over this, and they are suggesting that there are certain groups, for example, like men who have sex with men, and they're the ones that make up most of the cases. Is that true? I mean, I have a question up here as well. Are the elderly at risk?
Right. At this time, the data really does support that the predominant group that this infection is being seen with is men who have sex with men, and sort of the subgroups who are associated with that. However, anyone who's been in close personal contact with someone with monkeypox is then at risk. So
okay, so there is truth in it, but it is something that anybody can get from close personal contact.
Exactly.
Okay, so the next question then is there a vaccine? This is a multi-part, so bear with me for a second. Is there a vaccine? Who qualifies for that vaccine? And finally, and this is a question that comes up all the time as we have gone through COVID, does the vaccine prevent the infection or simply reduce the severity of the disease? So first one, is there a vaccine?
So yes, there is. The US has 2 stockpiled vaccines. They've currently only released one, and that is a very interesting vaccine. It's a live, non-replicative vaccine, so it's very safe and can be used in a wide host of patients, including immunocompromised patients. So that's the current vaccine that's been released.
Okay. And who qualifies? So it would be the immunocompromised. So what people make up that group?
So actually, immunocompromised is just for is not who qualifies for the vaccine.
Oh, okay.
Okay. Who qualifies for the vaccine at this time is really the groups that have been identified as being high risk for acquiring monkeypox. Okay. So as this is really driven by close physical contact. So the vaccine is being offered to groups that fit that description. So mainly people who've been identified as a contact of someone with monkeypox by public health officials. So say there is a reported case of monkeypox that somebody gets tested and they're positive. Then the Department of Health then reaches out to that patient and asks them about their living situation, where they've been, etc., and tries to identify if they're people they would consider to be at high risk of getting monkeypox, and would then offer them vaccine. Okay, so that's one group. The other group that's being offered vaccine are people who know of a sexual partner who in the past 2 weeks who's been diagnosed with monkeypox, or people with multiple sexual partners in the past 2 weeks in an area with known monkeypox, like the area we're in now, which fits the New York City and the surrounding area.
So does the vaccine prevent the infection, or does it just reduce the severity of it?
So if you have not had monkeypox and you are getting vaccinated because you are in these groups, it's felt that after it's a 2-dose vaccine administered 28 days apart, and the CDC is currently saying that 2 weeks after the second dose that you will have immunity to monkeypox. All these things we're telling you are carry the caveat of this is a new illness for us.
Right.
And that I think every day we're learning more and more. So whether some of these things that we're talking about today, and I'm telling you, we're going to say the same thing next week, I can't even guarantee that. So.
Okay. So again, I think the question that I was looking at the next question, and we sort of talked about immunocompromised individuals, but I guess what we want to figure out is the infectiousness of monkeypox versus something like COVID. You know, we're all walking around with masks on, you know, in the hospital and in our communities for a long time. Is that something that's necessary for people who are, you know, maybe at risk or in those communities? How infectious is it?
So again, I think it really goes back to the thing about it's primarily a close physical contact. Okay. Where people who are immunocompromised, young children, people who have skin disorders like eczema, etc., if they get monkeypox, are considered to be more likely to have serious illness from it. But right now, this has not become a illness of the general public, whereas COVID was, where we had to target and say, because these groups are at high risk, we're going to vaccinate them first. The strategy instead has been, let's try to identify, since this is a close physical contact illness, who those groups are, and see if by delivering vaccine there, can we then stop the spread. And that's starting to be the case. It is leveling off monkeypox in several countries in Europe, and the New York City is maybe seeing a plateau as well. Okay. So we may be seeing, between all the messaging about how it's transmitted, and I think the city has been vaccinating now since at least, I think, for 6 to 8 weeks. So I think we may be starting to get ahead of that.
All right. One of our audience members wanted to ask if someone is contagious without a rash being present.
It's a good question. It's being studied. I don't have a good answer for you for that. We don't know yet. We know when you have a rash, you're infectious. We don't know how long before, if you are infectious before you have a rash. And we don't know if other body fluids are like saliva or semen or urine and things are infectious. Those, again, we're, you know, this is an evolving area, and those who are studying this in the lab these are the things they're
looking at
right now.
Okay. So I guess then the next logical question is, how do people protect themselves if they think they're part of these risk groups, high risk groups? How can you be proactive? Are masking and social distancing measures helpful? And what are other suggestions you might have to be safe? So how to be—
Well, a general one for I think for the public, for everybody, is frequent hand washing. You know, hand sanitizing and hand washing. There's nothing for all of us with COVID and with this that is, I mean, I would recommend that for everybody. The second is, if you're, for all of us, and if you're very concerned about, you know, your risk for this, really to avoid situations right now while this is, you know, in this current sort of accelerated stage in the US, of avoiding situations where you're going to be in close physical contact with someone you don't know. So perhaps it's not the time, you know, it's summer, it's a time where we all have a lot of exposed skin. So if you have exposed skin and you have an area of your skin that has an abrasion or something, you should keep it covered. And if you're, you may want to avoid situations like crowded bars and crowded dance floors and places where maybe you're rubbing up against, you know, people, you're in a half sleeve or a sleeveless shirt, and you don't know that person. That may not be the most, you know, comfortable situation that you want to be in now. It's also probably with COVID, not a situation you want to be in now either. So I think, honestly, if you're still following some COVID precautions, I think they all pertain very well to monkeypox.
So one of our audience members is, you know, has got a somewhat specific question. If you are, let's say, a senior and you're in the local senior center and you're attending activities, can casual touch, and we've talked about sort of the very face-to-face things that happen, but can it be transmitted by casual touch? So you just talked about having something open on your skin, so that could be a route of transmission, but you don't know, or is that pretty clear?
But if you, oh, it could be if you have an open lesion and somebody has, you know, an open monkeypox lesion, and you know, you can certainly acquire it in that fashion. But that would not be jumping through the air. It would be skin to skin contact. So I think in the setting of a senior center situation, I think it's not a high risk group. So we can start with that. And the second is, I mean, again, good hand washing and hand sanitizing.
And a little bit of social distancing, maybe.
And a little, which is always, I think, with COVID, not a bad idea. Right. So, yes.
All right. Okay, so what can our community do if they suspect they've been exposed?
I think where you would start is, if you suspect you've been exposed. Well, I guess that's two questions. You're asking if you've been exposed, or if you've been symptomatic, or you're symptomatic.
Yes.
So
both questions.
Both. So yeah. If you've been exposed, probably the place to start is with your, or if you're symptomatic, is to start with your healthcare provider.
So primary care
would be to start at your primary care. Okay. If you feel that you're symptomatic and you have, then you really would want to isolate. You'd want to wear a mask around other people. You'd definitely want to social distance. You would want to have your own space if it's possible, because of this fomite and bedding and towel issue. You would want to cover any lesions if they appeared, if you were going to be around other people. And again, good hand washing and cleaning of all surfaces. Almost all the cleaning products we have are good sanitizers for this. So. The other issue, which is very interesting, is if you become symptomatic, is it's recommended by the CDC to isolate from your pets, because you can spread this to animals as well. They've just been one case now of a patient who had monkeypox, who I guess the dog shared the room, and the dog now has monkeypox.
Interesting.
So yeah, so we would, so they're actually say, ask someone else to take care of your pets.
Okay. So what, we just have another audience question here. What is the treatment plan for someone who is diagnosed? And then we'll go back and talk about someone who may or may not have their own primary care doctor. But so what does that treatment plan look like?
So the treatment plan is often just very, is symptom based. So often it's things like if you're itchy, which is why it's good to talk to a healthcare provider. It's like taking some taking an antihistamine. If you're having a low-grade fever, taking some Tylenol. If you're, doing a veno bath, if your skin is itchy, so it's often symptom based. Then these high-risk groups I had mentioned, if you have a weakened immune system, if for very young children, people who have skin disorders, and people who develop monkeypox basically on mucosal surfaces. They develop it in their mouths, if they develop it in their anal area, and can lead to pain with having a bowel movement. We call that proctitis. So if people develop those kinds of symptoms, they really do need to reach out to a healthcare provider, because through the CDC, there is a program to obtain an antiviral that has to treat these patients. But it's for a select group of patients. But and it's not a medicine that you can get at CVS.
Okay, so what I'm hearing you say, though, is that there are degrees of this when you get it, like anything else. Some people I know when I was a kid got chickenpox and it was a mild case, and other people got chickenpox and it was definitely a worse case. So this is the same thing that applies. So really, those antivirals that you were referencing were for people who are experiencing it in some uncomfortable places and who maybe are seeing it more systemic.
Exactly. And people who also fit these high risk categories, which is really the other reason that they should have a conversation with a healthcare provider. Because if they are somebody who is at risk for developing, severe monkeypox, then that may be a person who would be offered this medicine, which is called TPOX. And it's, but it really is, they're trying to make it easier to obtain, but currently it requires it requires a conversation with the Board of Health. It requires release from the CDC. It's a process.
It's a process. Okay, yeah. So another question, and I think you did address this a little bit earlier, but is there mortality with this disease, with this strain that we're seeing here?
I tried to actually look that up, and this is what I was, because as this is all kind of real-time stuff, apparently globally there's been 40,000 cases, okay, and there have been apparently, and I do not know the details of any of them, there have been 12 deaths, and I do not think there have been any that I know of, any US deaths. There have been 9 cases in children. And okay. There have been a handful of, and this is predominantly so far has been a disease of men, but there have been cases reported in women as well, okay, but much lower in numbers.
So you had referenced that if there is, that people, if they have symptoms, however they're showing up, they should seek care from their primary care provider first. Now, if you don't have a primary care provider, what would you say to those folks?
And even for seeking care with your primary care provider, I think the place to start would be with a phone call, because this again is a illness that if you're going to go to their office, they need to know you're coming. You need to go there, or wherever you seek care, if it ends up being an urgent center, etc., that you arrive there wearing a mask, you arrive there with your lesions covered, and and usually, and if you can arrive there with giving people notice before you come that you're concerned you have this, then they would quickly be able to take care of you. Okay. And if you don't have a healthcare provider, the Hope Center, which St. John's runs on Park Ave, is available for phone conversations and to help direct people to resources where they can get tested. The testing currently involves actually directly swabbing the lesions. That's how we diagnose. Okay. It's not a blood test right now. It involves having a swab of the lesion. So that would be, Denise, maybe a number you can later share as a contact for people who don't have a primary care provider.
Yes, at the end of the presentation, I'm going to give them an email where they can contact, and then we can give them the appropriate place to go. We have another one, but I'm not sure if that I think we may have addressed this, but I'm going to ask it anyway. Does the smallpox vaccine provide any cross coverage? So I'm not sure if they're asking about cross coverage for other pox illnesses, because I think that's actually interesting to me. If you're a certain age in this country, then you were vaccinated for smallpox when you were a child. Is there coverage from that? And for whatever year that ceased, you know, what do people now do in terms of, is there anything else that protects them?
Right. So, yeah, actually, this is one of those, being old does pay off, being older, because there is some there definitely is some protection. It's being, they think about 85% protection. But the recommendation still is that if you're of the age that you did get smallpox vaccinated, if you did have a true monkeypox exposure, they do recommend that you get a monkeypox vaccine.
Okay.
Okay. I also wanted to mention where there are vaccine clinics being run in the county, at least the ones I know of. The Department of Health, I think once a week, is running a clinic. The medical center, these are all by appointment only. There's no walk-ins. The medical center is running a by appointment drive-through clinic. So that would be another place that people could call, see if that they would qualify, and if they did, could get an appointment. And again, the Hope Center, we have not a big supply, but we have some vaccine availability, and it is possible to, it may be possible to get vaccinated in Yonkers there. So, and again, it's by appointment.
Right. So the recommendation would be, if you think that you want this, maybe make the phone call, or because I know the Hope Center does do telehealth as well. And, you know, you would make that phone call first and see if you meet the criteria.
Exactly. So I think, yeah, all of it would be really, to start with a phone call would be a good route.
Okay.
But if you're too sick, of course, and you really are not well, then you should seek care in the emergency room.
Okay. So we did have one other request, and I don't think that we're going to accommodate it, which is that someone wanted to see a photograph of what it looked like, but they are all over the media. And so I did want to just direct them to go on the internet and put it in, and you can see variations of what it looks like. And it looks like chickenpox to me. I mean, that's what it looked like. It's the same sort of a look to it. Any event, I have no more questions at this moment from our audience. So do you have anything else that you'd like to add before we close our program today?
Wash your hands. I don't think you can do infectious disease without saying that, especially in these days.
Yeah.
So it is really single-handedly one of the most protective things you can do.
All right. Well, now that you bring that up, give us some tips on washing hands, because I know people don't do it properly.
So, well, the hospital tip is singing happy birthday and washing your hands for 30 seconds. So that would be a
hot water,
a good way.
Soap.
Hot water, soap work. The old-fashioned things work well. And if don't have access, the hand sanitizers all work very well as well. If you're not in a situation that you can do that, hand sanitizers.
Well, I'd like to thank you very much, Dr. Hariharan. You are one of our healthcare heroes, and we really appreciate you giving up your valuable time to address this, because it's on top of people's minds right now. And before we sign off, I would like to just direct our audience that, you know, if in the meantime, if you think that you have an issue and you don't want to come into a provider in the office, we are more than happy to do virtual urgent care. And that number is 914-964-4429. And then you can get some more direction. And also for anyone who needs information about any of what we've discussed today, info@riversidehealth.org is one of the emails that comes to me, and I'm happy to respond to questions or give you direction. If you need a physician referral, we always ask you to call 914-964-4DOC, that's 4362. Thank you all again for joining us. We had quite a large audience, so it just showed how much interest there was in this subject. And that's it. I think we're going to say thank you again, and everyone have a great afternoon.